Welcome to another episode of the Empowered Fertility Podcast, the place where we dive deep into all things fertility. I'm Dr. Brenna Squires, a clinical psychologist and fertility support coach, here to bring you the knowledge, resources, and expert insights you need to feel confident along your journey to parenthood. So let's get started. Hey everyone, and welcome back to the Empowered Fertility Podcast. Today I have something really special for you, and I'm really excited to share that we're going to be talking all about Chinese medicine. This is an ancient healing system that uses acupuncture, herbs, nutrition, and mind-body practices to restore balance and help the body heal itself. We're going to dig into how this timeless approach can support your fertility, your hormone health, and your overall well-being. And I am joined by Chinese medicine expert, Dr. Yvonne Scarlett. She's worked in this field for over 15 years, and she's here to share some of her knowledge with us today. So welcome to the podcast, Dr. Scarlett.
Thank you. It is a joy, and I'm so excited to be here. Thank you also for the great work you're doing in educating women and empowering them. So it's a treat to be here.
Thank you. Thank you so much. I appreciate that you coming on. And yes, we are here to empower men and women who are on this journey of trying to be parents and trying to grow their family. So thank you so much. And as we dive into today's topic, I do want to start off with getting to know a little bit more about you and your background. So can you share more about your background and how you got started in Chinese medicine?
Happy to do so. I always say it was serendipitous how I came into Chinese medicine. I was very ill with chronic migraines, a host of issues, anxiety disorders, insomnia, you name it. I had chronic pain. And out of desperation, I decided to try. And I use the phrase try acupuncture because I didn't want to have surgery on my brain. And lo and behold, about 6 sessions later, 13 years of migraines were gone. And subsequent visits took care of the insomnia, took care of the anxiety, enough so that I could drive cross country to move to California to complete my medical education. So in my pursuit for perfect health, I found what I call a paradigm shift. And it became, and it is my passion today to educate individuals on how Chinese medicine and acupuncture can enrich and enhance your lives.
Yes, that's wonderful. Can you share a little bit more about Chinese medicine and their view on health in general, and then we'll go into fertility because they do view it very differently.
Definitely. Thank you for asking that question. So Chinese medicine is a holistic approach to health and wellness. It actually is more preventative than it is in terms of correcting or dealing with a crisis scenario. It's been in existence for over 5,000 years. It's a complete medical system. And even before we knew about Western medicine specializations, Chinese medicine had their specializations in geriatrics and gynecology, pediatrics, and so on. And it really takes a whole person approach, looking at your lifestyle, looking at what you're eating. Are you exercising? Are you getting enough sleep? And based on the seasons. So it's looking at the big picture in terms of how it addresses health and wellness. It's not symptom based, although when you address and you treat the whole person, the symptoms get resolved. So it's really a fascinating medicine that I've been doing this for 15 years and I still don't know enough. There's always more to learn about how we can incorporate Chinese medicine in everyday life. And especially today, it's very poignant and apropos in the modern setting. Who would have thought an ancient medicine is so ideal for dealing with modern diseases?
Yes, and I like how you said it's a complete medical system because a lot of times we're told that Western medicine is the gold standard, it's the ideal, and if you think of anything else, it's just something else that you can add on, or it's something that's slightly different. But it's nice to hear you say that this has been around for a very long time. It's not just something that you need to add on, or it's just something that you can do. It's actually a complete system.
It is. And part of my mission in educating individuals is that come to us first. Unless you have a medical emergency, go get that sorted out. But come to us first when you're having the insomnia issues or you're having digestive issues, we can help. It's more than just acupuncture. People know acupuncture as one for pain, right? But acupuncture does so much more. It can treat almost everything. And I need to be careful saying treat. We can address and support almost everything with acupuncture and Chinese medicine. So this should be the first stop. And part of me or my process and my focus is helping people understand. Come to
Yeah.
us first.
Yeah, and can you share a little bit about Chinese medicine approach to fertility specifically?
Certainly. So in Chinese medicine, there are cycles, and I'll focus specifically on the female aspect of it. So the menstrual cycle we treat based on phases, whether someone is looking to get pregnant or not. Once a woman starts menstruating, if there are issues, so for example, we think PMS is normal. It's not. I suffered for years with that and painful periods. It's not normal. When you look through the lens of Chinese medicine, it tells you that this is something that needs to be corrected. It's an indication that there's an imbalance somewhere. So we look through the different phases of the menstrual cycle. There are four phases that we look at. And incidentally, they correlate to the hormonal changes that's happening from a Western medicine perspective. And if someone is dealing with PMS, then we treat that with lifestyle modification. We use Chinese herbal prescriptions. If there's appropriate exercise that needs to be done, we look at that as well, because the whole idea is to get the body back into balance. If something is up, if you're having PMS symptoms, if a woman is having irregular menstruation, if she's ovulating too early or too late, that impacts fertility. So when we are looking at that four-phase approach through the lens of Chinese medicine, we can tell where there is a disconnect, where there is an imbalance. And through those methodologies, whether it's acupuncture, Moxibustion, again, food as medicine, or any of the other tools that we have in our medicine bag, we can address that and bring the body into balance, regulate menstrual cycles, get ovulation back on track as it should be, and get the body ready to conceive, confidently conceive, which is it's meant to do naturally.
Yeah. And so you're bringing that woman's body back into balance when you're looking through that lens of that whole person approach. How does this impact the men? Because they are 50% of of the whole process as well. How does Chinese medicine view fertility for men?
It is the same. They're a slightly different approach from in a Chinese medicine perspective, where men are, yes, they're encouraged to have sexual intercourse, but there are, I put boundaries or guardrails so you're not wasting your seed. So we talk about jing or essence that correlates both to the women and specifically to the men where it comes to their semen quality, semen analysis, and so on. If they're having too many ejaculations, they're draining, they're wasting their jing, that vital essence that's needed to procreate. So it's not prohibited to have sexual intercourse, but we don't want it to be excessive. We don't want to excessive masturbation, that type of thing. For the man to also look at how he's eating, what is he eating? Is his lifestyle or his activity jeopardizing his sperm quality? So it's not just the woman, it looks at the man as well, but it's a different lens, a
Yeah.
different approach.
Is there some type of cycle that you're looking at for men, like the 24-hour cycle or something different, or is it just in general?
In general, overall, it's in general. And again, if we correlate with the Western medicine perspective, the sperm it regenerates within 72 days, or and with the woman 120 days for the regulating the cycle to get the optimal benefit.
Yeah. Yeah. And so let's go a little bit into the testing because Chinese medicine evaluates things a little bit differently. One of my favorites that I think it would be fun to start with is the tongue and the tongue analysis. So can you tell us a little bit about what that looks like with analyzing the tongue?
Yes, I'm glad you asked because many people don't realize that the tongue tells a tale of a lot of things that's going on in the body. And again, Chinese medicine as a functional medicine model uses all the tools, right? They didn't have the labs. So now we look at the tongue. The size of a person's tongue, the color of a person's tongue, the shape, if there are markings, cracks, if it's a thin coat or a thick coat, do they have teeth marks? We look at the sublingual veins under the tongue. Those tells us is there a digestive issue going on? Is there an issue in the, and I'll say organs like lung or whatever. I'm specifically talking about the channels, not the organ itself. So if there's something going on in the lung channel or the kidney channel, is there something, if there is a red tip on the at the tongue, we ask about it, does the person have palpitations? Are they having nightmares? Or generally, if you see that red tip, it indicates maybe some anxiety, whether it's a chronic or acute condition. So the tongue gives a wealth of information as to what's going on with the internal systems in the body. And based on that, we create a differential diagnosis and a treatment plan for the patient.
Very, very neat. It's
It
very neat
is.
that like you had said, before we had all of these types of functional testing that we could just do lab work, there were other tests that could identify what's going on in the body.
Yes.
So this has been done way before that, way
Long
before the
before.
blood work.
Yes. And I think what I find wonderful about Chinese medicine, we look at the person. So when someone comes in, we're looking at their skin. Does it look healthy? Is it dull? We look at their eyes. Do they have that spark, that brightness in their eyes? Um, is there an odor? Because it'll tell us it can be a precursor to a disease, and we can pick that up. So again, and we palpate, we check to see what's going on. So all these tools work together to give us the big picture of what's going on. And even what the patient isn't telling us, we can pick that up by doing all these other things to, again, get a more accurate differential diagnosis to create a customized care plan for them.
Okay, yeah, so it's not just the tongue, you're observing what the body is actually telling you, what the skin
Exactly.
is reflecting the eyes
Yes.
and maybe the
Yes.
posture or things like that,
And how they sound, a person's
and how they
voice. We
sound.
can tell. Yes. Yeah. It's
Tell us more about
fascinating medicine.
that. Tell me more about how do you, know the difference between how they sound? What's
So if someone comes in and they're very soft spoken and they're almost monotone, we tend to think this is attributed to the lung channel for the soft spoken voice. I remember a particular professor that, and he'll tell you he has lung chi issues. So that's one thing. If someone comes in and they're, oh my God, and they're vibrant and carrying on, woo, ooh, oh, wait, that sounds like a liver person. They're very excited, very forceful in their approach. So it gives us little clues as to how a person is and their personality, or as we call it, the constitution of that individual. Again, that comes in as part of the care.
Yeah, and so you're saying that as they present with their voice or their posture and their body, that those particular areas of the body are struggling or are working, something like that?
Not necessarily struggling,
Okay.
but they give a clue as to this person's characteristics.
Okay.
If they say, for example, I said this person, like the very soft-spoken professor that I had, that there's lung chi issues. There's certain foods that we use to help to support lung chi. So they to build the voice, to create more stamina, in terms of how they present themselves. But there again, a person may just be that may be their personality. And we accept that and we treat within that framework.
Neat. And so when you say lung qi, are you referring to qi as like the energy where the energy is being stored or blocked?
That's an interesting question. So chi is a very interesting phrase. So there's so many different explanations. I call it intelligent communication. I call it life force. When it comes to the lungs specifically, it's how you breathe. Are
Okay.
you having shortness of breath? If you take a deep breath, do you cough? The aspect of breathing, it actually correlates with the physical lungs, but we talk about the lung channel and its attributes. So yes, it could be something is going on with that person's lung. Like for example, I have a couple of disorders that affect my lungs. And interestingly enough, when I went to Chinese medicine school, I didn't look at my tongue a lot before. And there are markings on my tongue in what we call the lung area of my tongue that are consistent with the fact that I have some challenges with my lungs. And I found it fascinating. So again, the tongue tells me the individual, how they move, how they act, how they speak, gives me clues as well as to what's going on. So it may be an imbalance, or it could be their constitutional disposition.
Very neat. Very neat. And you also mentioned one other test. I know there's probably other tests, but you also mentioned something with the pulse. Can you share a little bit more about the pulse test?
Pulse is fascinating. Not a lot of people use that, and I don't often use that, but there are times I do. The pulse, from a Chinese medicine perspective, looks at not only beats per minute. We check to see how many beats per minute. If it's a fast pulse, that tells us clues in from, again, always through the lens of Chinese medicine. We have 28, 29 different pulse qualities that we have in Chinese medicine that we use in conjunction with the tongue to create a diagnosis. So if someone has a rapid pulse, is that an indication of a low level infection? Are they having some chronic inflammatory issues? Is it severe pain? So again, it's a part of the puzzle, or part of one of the tools that we use to get the big picture, to treat and to create a custom care plan for our patients.
Yeah, so you take the pulse and the
Mhm.
assessment of that, and then combine it with, like you say, the tongue, and then maybe other testing, and then those little puzzle pieces create the full picture.
Right. We have questions. Like if you went to a Western medicine doctor, then we call the review of system. So we look at their sleep. We ask questions about sleep. We ask about appetite. We ask about elimination, all those other aspects of a person's life, and combine all these things together to get a clear picture of what is going on. And many times they don't tell you, but once you're talking about their experience, you get clues, you get answers as to what's going on just based on listening to the patient talk about their condition.
Yeah, I think that's so fascinating. Those puzzle pieces that you don't even need to go outside of the doctor to be able to figure those things out. Are
True.
there any other different types of tests that you use besides those two?
If someone were coming in, so that's another great question. If someone were coming in for, if they had a chronic or pain related issue, orthopedic kind of scenario, then we have other tests that we do to test range of motion and so on. And I still do that, not necessarily so much for fertility patient. It doesn't fit that particular mold, but I do palpation. I palpate the abdomen. I palpate the thyroid if that's an issue. And again, all the things, all the pieces together to get an idea of what's going on so I can appropriately create a care plan.
Is there anything specific or in particular that you find that you use with fertility patients,
Just from Chinese medicine?
just from Chinese medicine, or if you integrate Chinese medicine with something else?
I do. From the Chinese medicine perspective, like I mentioned, we do look at the four phases of the cycle to see what's going on. We ask about, and it may seem odd, we ask about the color of the menses. We ask if they have clots.
Mhm.
And the color of the clots and so on tells us what's going on so we can create an appropriate treatment. And as a functional medicine practitioner, I also do comprehensive lab reports. So I'm looking at the CBC with differential. I'm looking at the comprehensive metabolic panel. I'm looking at thyroid panels, and I'm looking at hormone labs. Those markers, those levels will tell me about the inflammatory issues with that person that could be prohibitive, affecting their fertility. If they have nutrient deficiencies, that could be impacting their fertility. Um, could they have a low level infection that's showing up in their white blood cell count, whether it's your neutrophils, lymphocytes combination, and the ratios, because those tell me what's going on as well. So I look at that as well to see if you're a healthy human being, you have a diagnosis of unexplained infertility, which is a blanket statement to cover something else that no one is willing to delve deeper to
Mhm.
find out what's going on. Labs do that for me. And of course, the tongue and pulse. I can tell if someone may have some digestive issues. Again, looking at the tongue. Could that be impacting fertility? It possibly could because they're not getting the nutrients. The body's not absorbing the nutrients that they need. The pulse. If the pulse is fast, could it be that they have a low level infection? So it's tying in with the more modern labs, the modern tests that we have. They corroborate each other,
Yeah.
and that gives me even a more powerful approach to creating a care plan for my patient.
Absolutely. And it sounds like what you do is you get the background information and then you do those initial assessments with the tongue and the pulse, and then also looking at the physical characteristics of things. Like you said, the physical characteristics of your body and then what your body is producing. And then that gives you an indication about what might be going on, which
Correct.
then tells
Yes.
you which tests to do. And it looks at the levels or the markers, like kind of like the
Correct.
severity.
Yeah. Deficiencies, yes, as well, if something is off, because oftentimes they're missed. They're patterns or labs or values. They tell us something, tells a story. And if you're paying attention, you'll see it. And oftentimes it can be missed. And just a small tweak could be just adding a food or taking something away from that you're eating that's not ideal for your particular scenario could create a shift. Yeah.
Yeah. And it sounds like it could also be faster to getting an understanding about what's going on because if you can do some of these tests in office, you don't have to necessarily wait for all of those labs to be able to do something.
Correct. I never wait for the labs. I start just with, again, Chinese medicine is my foundation.
Yeah.
The other stuff are adjunctive. They add, they give me a bit more latitude to create better care for the patient or to fill in the blanks that I may, like, we did all these things and we hit this level. Something else is off.
Yeah.
Something else is missing. Let's do some labs and take a look and I'll
Yeah.
see. Yeah.
That's awesome. So let's go a little bit into or let's dive deep into the treatment. So what are some of the different treatment options that are available?
Um, for when someone comes in, there is a treatment plan. So I use, of course, acupuncture. That's a given. Some people need more acupuncture treatments, some need more Chinese herbal prescriptions. So there's acupuncture. There's customized Chinese herbal prescriptions for the individuals, the male and female, because we've got to take care of him as well. We look at lifestyle in terms of nutrition. What are they eating? Are they eating consistently, regularly? Are they eating high quality foods? Is it too much processed foods? Are they having too much sugar in their diet? Are they still having alcohol when they're trying to conceive? Those are things we look at and they're removed temporarily to get them to the desired goal. We look at exercise. Could you be exercising too much? There's such a thing. If you're doing hot yoga and you're trying to conceive, that may not be a great idea. The guys who are in their tight briefs, not okay. So these are all the things we look at. Are you getting enough sleep? Or are you one of those that's burning the candle at both ends because you have your financial commitments? So everything, we look at everything. Are you sleeping through the night? If you're not, let's figure why that's happening and correct that. Are you managing your stress? Fertility challenges, fertility journeys come with their own set of challenges. So we're looking at that as well, and we're offering mind body, mindfulness, visualization, all those things, and tools like Qigong and Tai Chi to help you to relax and to get the body back into balance so you're not stressing. So you can get pregnant. If your body is in this stressful state and just trying to survive, it's not going to be willing. The body is saying, no, you're not ready. We have too many, we're just in survival mode. How can we conceive if we're in survival mode? So it's getting the individuals back to baseline of getting into balance, living life on a level where it's fun. It is fulfilling, enjoying your life, laughing, enjoying delicious meals, whole foods cooked, and just having a good time. And I think what I've seen many times is when those pieces are corrected, pregnancy happens because the body's now in a state of relaxation and balance. Like, oh yeah, we're good. We can bring this person into being now because it's not in survival mode. And it's really about individuals empowering them to look at their life.
Mhm.
Are they
Mm.
really ready?
And I want to go back to one of the first things that you said with was acupuncture. You said you give everybody acupuncture. Can you tell us about some of the reasons why you would give that or some of the areas that you focus on, at least when it comes to fertility?
Yes. Thank you for asking that. So acupuncture, I use it a lot to regulate menstrual cycles. So if someone is has a too long or too short cycle, that's going to affect fertility. So we're going to do everything we can to regulate the cycle to get it back to 28 to 32 days. And also that they're ovulating when they ought to. So we're using acupuncture to help with that as well. There's something else I didn't talk about, and it's called Moxibustion. I do that in conjunction with acupuncture. It's a Chinese medicine modality where we burn Chinese herbs. One of them is mugwort over different acupuncture points. And specifically, what I do it over the lower abdomen in the area of the ovaries and the uterus. I also do it on points on the leg that are part of the channel that helps with blood production. I do it to help to promote warmth over the ovaries so that we can keep the womb warm so it's inviting, to improve equality. We improve circulation to those vital areas of the uterus and the ovaries because we want to make sure those are well supplied to receive, to one, not only to have good equality, but also to be able to implant and to hold a pregnancy. So moxibustion in conjunction with acupuncture are used over the abdomen, points, distal points on the arms and legs that we use as well. In addition, we do ear points. The ears are phenomenal. We do ear acupuncture. There are points for the ovaries, for the uterus that we use as well to help to stimulate those organs, to regulate those organs as part of the fertility treatment protocol.
Very neat, very neat. I've never heard of the I don't even know how to say what you just said, but the mugwort.
Moxibustion,
Moxibustion.
yes.
Putting that, I think that's so neat, and you said that that brings warmth to that area?
Hmm. It does. It's because we want a warm, inviting womb
Yeah.
to be ready. We call the womb the palace. We want to have that palace ready for that baby that's coming. So yes, in Chinese medicine we always talk about keeping the abdomen, the lower abdomen area of the womb, the ovaries, keep that area warm, covered. We're also keeping your feet warm. If you have cold feet, cold womb. So we tell our patients, the women, you gotta wear socks at home, don't walk on cold floor, things like that. It sounds kind of crazy, but it's not. It really does work. We see the difference when these tiny changes are done to improve
Yeah.
fertility.
Yeah, warm womb. I heard someone say something about if it's a cold womb, it's uninviting.
Exactly. Exactly. So we want to encourage this baby to come. We're creating the space
Yeah.
we're preparing the palace is the phrase we use. We're preparing the palace.
Yeah. And let's talk a little bit about the herbs. Are the herbs specifically designed to help with blood flow and a warm womb, or is it something else?
All of the above. So
All of
yes, if someone comes in to us and they're having fertility challenges, and based on our differential diagnosis, say for example, we see that their digestion is being impacted. Because if that is off, you're not getting the nutrients and it could potentially be causing other issues in the body. It's never in a vacuum. So we're going to treat, that's the root cause. So we're going to treat the GI system to get that back on track. If you're digesting your food, you're getting the nutrients, then what is needed for the uterus and the ovaries to be in optimal operating condition will happen. So we treat that. If we need to get better blood flow, there are Chinese herbal prescriptions that we will prescribe for that. And it's never a lifetime thing. It's as the symptoms change, we change the formula because things are changing. It's not the same thing we're addressing. So we do formulas to increase blood flow. We do formulas that help to reduce inflammation, whether it's in the uterus, the ovaries, or systemically. We do herbal formulas that will help to regulate anxiety, so down regulate anxiety. So that's not an issue, and to help with insomnia. So we can create custom formulas to treat whatever the root cause is so that the body is now functioning as it should and is a ready space for conception.
And those are very tailored to that individual,
Correct.
correct?
It's not a one size fit all session. No, not at all.
Yeah. So what are your thoughts? I know I didn't ask you this before, so I hope you have a good answer. But what are your thoughts on those those herbs that you see that people will be selling online with herbs that are just teas and things like that that could be helpful for regulating your cycle. Do you think those are helpful or they could be harmful?
That's a loaded question.
It is. We're not calling out any tea people in particular, but I was just
No,
curious.
I will not.
Okay.
However, what I say is what may be good for your girlfriend may not be ideal for you.
Okay.
You may not have the same root cause issue. So the formula that she's taking may not do you any good. It actually could exacerbate your condition. So it's very important to speak with a licensed herbalist, a professional who has gotten to know you, the person, and knows what's going on, what are the underlying issues, and can create a customized formula specifically for you. It's tempting to see this is the new herb or this is in fashion right now, but it may not be ideal for you. I get concerned about bioavailability, the quality of the product. Are there what we call excipients? Is there enough of what they're saying the product is? There enough of it for it to be valid for you to take it? I don't, I'm careful about the products. I have very specific sources that I trust that I use. And that's what I tell my patients. Oftentimes they'll say, I saw such and such. I'm like, you have this particular condition that's not ideal for you because, and these are the reasons why. So I would strongly recommend that they speak to a licensed herbalist before taking something just like that.
Yeah, thank you for sharing that because I've seen those before and the way that you were describing how you make these individualized, it makes me think that those teas are not as one size fits all as they present themselves to be because the teas are combination. And so the
Correct.
combination of teas, some of those ingredients could be helpful, but there are other ingredients that could be harmful for you in particular because you have
Correct.
underlying issues.
Correct. That is correct.
And that's why it's helpful to be able to meet with somebody like yourself that actually knows what every single thing because we can't read all of those ingredients clearly. We don't really know what everything is in
Exactly.
those teas. You can say, "Oh, I understand what maybe lemon balm is," but I don't know what some of these other things are, and those are the things that could be harmful. Like you said, if you have underlying gut issues or Hashimoto's or
Correct.
something else that it could trigger an immune reaction or trigger something else.
And if you're on a medication, you
Yes.
don't know the drug herb interaction. That could be detrimental to your health and well being. It could make whatever prescribed medication you're on not work well
Mhm.
or intensify its effect over a time that it shouldn't. So it's really important to know who are you talking to that they know what they're dealing with. They're licensed, they have the training that knows that okay, if I'm taking these medications, I cannot combine these herbs or dosing or timing. All those are very critical.
Yes. Yes, and that's something actually I've been learning recently about that teas are like medicine. They
They
have a
are.
specific purpose. They're not just
Yes.
there to drink like water. It's not just something that you're doing that each one has a specific purpose and if you're not mindful, they could have a drug interaction or a supplement interaction or a
That is
negative
correct.
response to your body. And so we need to shift the way that we're thinking about some of the things that we're taking as it's some type of medicine, and it's not just a drink.
It is food
Not
as
just a drink.
medicine, is herbs as medicine, yes. Even something as innocuous as mint tea. It's
Mhm.
not everybody should be drinking mint tea. If you have a particular gut condition, you shouldn't. So yes, it's really important to kind of to get the guidance in making these decisions, things that you're putting into your body.
Yeah, absolutely.
Yeah.
And if someone's listening right now and they're saying, "Okay, all of this sounds good," is there's something that they can specifically start doing right now? Like, what would you say would be 3 tips that they can do from this approach that they can start working on right now?
That's a great question. Actually, that's in my ebook. Three simple things. Manage stress, whether it is work related, it's emotional, mental, manage stress. And I know we said it all the time. Manage stress, take care of your stress. But how do you do that? You can do that by meditating. You can spend time out in nature. You can journal, take a yoga class, Tai Chi, something to manage stress. Get good sleep, meaning have a sleep routine that's healthy. Step away from your devices, shut them down an hour or so before. Maybe have a sleep ritual. Maybe it's like taking a nice hot bath or a warm bath or a shower, reading a calming book, something that is going to help you to de-stress and unwind as well so you can fall asleep. Get to bed early. Early meaning before 10 o'clock. Because from a Chinese medicine perspective, that helps the blood to get back to where it needs to be so your body can get the detoxing from the brain, replenish the blood. So the next day you're good to go. You wake up feeling rested. So manage stress, sleep, watch what you eat. It's best to eat what's in season. And how do you know what that's all about? Check out your local farmers market. You'll know exactly what's in season by what they're offering at that particular time of year. Eat locally. If you can't buy organic, eat locally. Again, those are beneficial for your body. In Chinese medicine, we talk about eating for the seasons, and the way to do that is to see what's growing in your area from the farmers market. If some people say organic foods are expensive, potentially, then eat locally. Go to your farmers market to see what they're selling and try those different things, different vegetables and fruits, because those will be beneficial for you.
Yeah. And can you share a little bit more about why we need to eat for the seasons or why that would be helpful?
Yes, ideally I can. So, say for example, in the winter time, we're we tend to slow down a bit. We tend to spend, maybe not so much in San Diego, but if you're living in a cold place, right? You tend to spend more time indoors. You're not as active. Your body is more susceptible to picking up a pathogen. So, primarily, what I do in the changing of the seasons, I take foods that are going to strengthen my immune system. So, I'm less susceptible to catching a cold or the flu or anything like that. Eating specific foods that are at that time of year that'll help to strengthen my body and boost my immune system. In the summertime, we have a lot of fruits. We're more energetic, we're lively. We don't need the heavy meals that we would typically have in the wintertime. So in the summertime, you're eating the fresh fruits that are in season. So the watermelons are in season, the cherries, I'm talking about what I'm seeing here in California, the cherries, the blueberries, the grapes, all those things, and the plums. Ooh, delicious plums. Those things are ideal because that's what in season right now. And we need the vitamin C. Works with your body, you're being outdoors to help to create the vitamin D that your body needs for all the other things that your cell needs to perform. So paying attention to the shifting of the season and eating accordingly, we actually help to safeguard our health and to be at its optimal best in terms of vitality and function.
Nice. So it sounds like it kind of works hand in hand where the things that are in season actually help your body perform best
Correct.
during that season in general.
Yes, yes. I think it's fascinating how these ancient Chinese medicine doctors knew this. But they did look at nature. They did watch nature. They looked at the
Yeah.
changing of the tides and the
Yeah.
moon and all of that because that impacts us. And the food that we eat that's growing at that particular time is actually more ideal for us.
Yeah, and if you think about it, in the fall we usually have the squash, and we have a lot of things that are warming, more of the soups, like
Exactly.
stews. Whereas in the
Yes.
summer we have again fruits. That's where we have the fruit salad and the smoothies, and so
Yes. You get
cool
it.
our body
Yes.
down and then
Exactly.
warm our body up.
Exactly. You have it. You got it. That's exactly right.
Cool, very cool. So we just need to work on, I guess, being more mindful, and that goes to that
Yes.
mind, body, spirit approach, right? Being more mindful to
Correct.
help your body calm down, but also being more mindful about what's going on around us
Yes.
and what
Yes.
we're doing to our bodies.
How we are being in nature, being in our environment. Yes.
Mhm. Wonderful, wonderful. Well, as we come to a close with this podcast, are do you have any final thoughts for our listeners?
Enjoy the process. Don't stress so much. Just go with the flow, have fun, enjoy your partner, and just enjoy your life. And it will all happen once you let go of the that vice grip of wanting it to happen in a particular time frame. Just go with the flow. Be happy.
Go with the flow. I read this book one time that says, "Go with the flow. The flow knows where to go."
I like that.
Well, Wonderful. Well, wonderful. Thank you so much. I really appreciate you taking time to speak with me and to share your knowledge with everybody out there.
It's been a pleasure. Thank you so much.
Yes, and thank you so much, listeners. I appreciate you taking time to listen. If you have any questions or thoughts, feel free to put it in the comment section, and then I will see you in the next episode. Take care. Thank you so much for joining me today on the Empowered Fertility Podcast. If you're looking for personalized support on your journey, whether that's through therapy or coaching, please reach out. Just complete the contact form linked in the show notes, and someone from my team will be in touch with next steps. Remember, you are not alone. You are not broken, and your story is not over. See you in the next episode.